Good afternoon, everybody. My name is Dr. Tim Errington. I'm sure many of you know me. I decided to dive into this topic of gut health because what I've been seeing over the last few years, actually since I started in practice 20 years ago, there's been an enormous rise in people suffering from digestive disorders. So I've been doing a bit of a deep dive on this one. I've been learning a lot, so I can pass on some what I think is very, very important information. If you have any questions, please pop it in the chat. I can do a Q&A at the end. I do believe this is a really important topic, and what I want to do is try and inspire people, perhaps maybe help teach people a few things about their digestion that they didn't know, for the greater good. One thing's for sure is that we need to have a good digestive system if we want to be healthy. So today we're going to dive into a few digestive disorders, and I'm going to talk about heartburn, constipation, diarrhea, cramps, bloating, IBS, Crohn's, celiac. All these are conditions, but I'm going to address it from the point of view of function. What we want to do is we need a gut that is functioning properly, and so that's what we're going to talk about: is how does the gut work, and what happens when it goes wrong. We'll talk about leaky gut, which has been in the news an awful lot recently. Where does gluten fit into all this? And I'm going to talk about autoimmune conditions. This is one of the largest growth areas, if you like to name it that way, areas of disease in the world. Autoimmune, it's where the body's attacking itself, and this can be traced back to the gut. So this really is very important. So what I want to do is I want to start off introducing the chiropractic philosophy. Now, what do I mean by that? Well, I've been doing a series of talks, and we've been calling them the body signals program, because our body gives us signals all the time. And if you've got something wrong with your body, you're going to get signs and symptoms. And this is just the body telling us that something wrong. I want us to start thinking a little bit more deeply, more intelligently about how our body works and how it communicates with ourselves. One thing is for sure, all these digestive disorders, and if I named them all, we would be here all day. There are literally hundreds of them. They are named by the medical community because that's what they do. They name them, they blame them, it's the condition that's the problem, and then they tame them with drugs. I want us to start thinking more in terms of function. What is actually going on? Because I know that every time you have a signal, and that might be some digestive pain, it might be some diarrhea or bloating, whatever it is. These are body signals, and you can bet that there is something going on under the surface. And today we are talking about not so much what's above the surface, but what is beneath the surface. This is really, really, really important. All the time our body is giving us signals, signs. We really need to be listening to what our body is telling us. So I like to use this little this diagram because at any one time we are all somewhere on this continuum. We're either, very few of us are dead in the middle, which is balance. The people who experience high levels of wellness, they have an awareness that you have to be proactive in life. You have to be proactive in your health. Unfortunately, many of us are less proactive and more reactive, and we wait until we get signs and symptoms before we take our health a bit more seriously. And unfortunately, if we wait for signs and symptoms, there's already something wrong. We are edging ourselves towards disability, which unfortunately will lead to loss of vitality and premature death. it is the chiropractic philosophy. It's the paradigm that we live in, that we educate ourselves, we learn how the body works, we listen to how it communicates with us, and we take proactive steps. This is a growth mindset, and it leads to high levels of wellness. Okay, if we're getting signs and symptoms, if our belly, our gut is telling us something, we really need to think about what it's saying to us, because if we ignore it, that's probably not going to be a good idea. So, thinking like a chiropractor, I don't want any of you to become chiropractors. You don't need to. But if I could teach you how to think a little bit more like a chiropractor, that really is going to help you enormously going forward. So I want us to think about, how does the body feel, and relate that to how is it functioning. If it's not feeling so good, then function's probably down. All the time, the body is controlled by the nervous system, of which there are 3 main parts. Now, there's the motor nerves, the nerves that control our body, that move our muscles, and that gets us through life. That's for about 40% of our nervous system. And then, of course, there's the autonomic nerves. This is how the body works. So this is all the vital nerves for all the organs, including the digestive organs. And if we're getting any digestive problems, you can bet that it's these digestive nerves that are either part of the problem, or they're trying to be part of the solution by giving you these signs and symptoms. These autonomic nerves are about 40%. Now, what we are aware of course, are not so much these autonomic nerves, because you don't tend to feel them. What you do tend to feel are the sensory nerves. And these are the nerves that come back from our body, and they tell you, are you feeling pain, or why is the body giving you pain? Or maybe it's hot and cold, some kind of sense of feeling. These are less than 10% of the nerves, okay? Now let's go back to those autonomic nerves, how the body works. Obviously, these are the most important nerves. Now there's a major part of these, and these are actually called the enteric nerves. We have something that's called the enteric nervous system, and it's part of the autonomics, and it's really how the body controls the nervous system, controls the digestive system. This enteric nervous system, some people call it the second brain, because there are so many nerves there. There's literally over 100 million nerves wrapping themselves around your digestive tract and passing information backwards and forwards through the spinal cord to the brain. There are so many nerves that people actually refer to it as the second brain. Actually, some people call it the first brain, because if we go way back in history, before we developed the intelligence that we have now, then we acted more from the gut. We've all heard of this gut feeling. We have a gut feeling. This is the enteric nervous system talking to us, okay? It acts independently of the brain. So it really does, it really does control the nervous system without our thought, okay? It's acting automatically. And why is it so important to how we feel? Well, this gut of ours actually produces many of the neurotransmitters the body produces. So we all know what serotonin is. That's what makes us feel good, right? 95% of the serotonin produced by the body is in the gut. So if the gut's not working so well, then we're not going to be feeling so good. And then we have the dopamine. That's the reward sense that, you know, when you do something, you're feeling happy, you get a dopamine rush. Again, 50% of that comes from the gut. Okay, so this is really important. Now, many of the sensations that we get from the gut, whether it be good sensations or bad sensations, they are something that we need to be aware of. Now, unfortunately, most people have got this understanding, or this misguided understanding, that if you have something wrong in the gut, then you can just pop a pill. And this really has turned out to be a very dangerous belief. Some people even nowadays believe that drugs actually work. Now, of course they work to an extent, because Everybody takes drugs every now and again. They do work very, very well in certain conditions. But let's think a little bit more about drugs. This, believe it or not, is an advert from the television in the United States, where drugs companies can actually put adverts on the television encouraging you to take certain drugs. So this one is called Prilosec, and it's taken for if you're having some kind of reflux or indigestion, then it's encouraging you to take Prilosec. Now, let's think about this just a little bit more. What you see there could be taken as a bit of a representation of the American way of life for many. Not everybody, but certainly for many. It's a life that's probably not so healthy. Certainly there's a lot of bad food involved. Here we have a corn dog stand, which I would imagine at certain times are very, very popular. Everybody likes fast food in America. Now, obviously this is very unhealthy. If you look at what it says at the bottom there, in their advert, it says it's okay. It's possible to live this lifestyle if you take Prilosec, over-the-counter medication. It's saying it's okay to have this lifestyle if you take the drugs. Whoa, to me, that's deeply shocking. If we go on to read what it says at the bottom, it says only use as directed for 14 days to treat frequent heartburn. Do not take for more than 14 days or more often than every 4 months. So you shouldn't take it for more than, you should have 4 months between taking it, and then you should take it only for 14 days unless directed by a doctor. It's not for immediate relief. So you have to take it for those 14 days, but then you can't take it for 4 months. So why would that be? It must be getting you some relief because people keep coming back for it. But we need to think about the side effects. Now, they call them the side effects, but we need to call them the effects. This is the small print. I dare you to try and read the small print. You can't read it because there's literally so many of these effects that they can't fit them on the packet. Also, don't really want you to look at the side effects. But the reality for Prilosec, which is a very common medication in America, this is what it gives you. It might give you headaches or stomach pain. Remember, you're taking it because you've got pain, but it could give you pain. It might cause irregular heartbeats or muscle spasms, seizures, diarrhea. I apologize for going through this, but I really want you to think in future to start looking at the side effects. Abdominal or stomach pain, cramping, that's what it's meant to be stopping, remember. Fever. Why do we get fever? Well, it's actually creating an your body's immune system is actually recognizing it's something that shouldn't be there, and it's mounting an attack. What about giving blood or mucus in the stool, rashes, itching? These are all things that, obviously it's not good. Dizziness, trouble breathing, this all is not good stuff. These are the possible side effects. And that's why I really think we need to be thinking a bit more intelligently about whether we take these drugs or we go back to fixing the cause of the problem. Another dangerous belief that I see all the time is that your problem might just go away if you ignore it. And of course, many of these do go away at the beginning. But if there's an underlying condition, then the problem is going to get worse. Of course it is. Remember, the body's telling you something's wrong. These things tend to not go away. They tend to get much, much worse. And so let's think about what is causing the problems. Let's just think a little bit about, I've mentioned in most of my talks why chiropractic is so important for dealing with many of these issues. But I'm now going to bring it back to how the body works. One of the main causes of disease and conditions, certainly in Singapore, but throughout the world, is stress, of which there are 3 main causes of stress. Think in terms of the 3 T's. So, thoughts. How many people have got anxious thoughts at the moment during COVID? How many people are stressed at work and stressed with family and stressed, they're worried about their jobs, etc.? A huge amount. Huge amount of people are having these anxieties. What about toxins? Toxins, what are they? They're bad things that we put into our bodies that come from the outside. Where could they be coming from? Well, there's toxins in the very food that we eat. There's toxins in the environment. There's household goods, etc. There's toxins in the water, in the air we breathe. Okay, so these are all things that cause stresses on the body that cause loss of function and drive us away from health. And then, of course, there's a third stress, which we in chiropractic, we deal with every day, traumas, of which there's two main types. There's macro traumas. Think in terms of falling down the stairs or being hit by a taxi. That's going to be a stress. It's going to definitely stress the system and cause some changes. And then, of course, there's micro traumas, which is what we deal with every single day in our clinic. What could that be? Well, perhaps think in terms of bad posture, misalignment of the spine, tension, stress on the spine, all causing stresses on the nervous system. So let's think a little bit, before I move on to all these various conditions, of where I may come in as a chiropractor. Why is it so important that we look after our spines and our postures? And why do I get involved with the nervous system, the digestive system? Well, let's tie it all together a bit. So we spoke about how the body works, and we've got this autonomic nervous system, of which a great part of it is the enteric nervous system, which controls digestion. So there's two parts of this autonomic nervous system. There's the parasympathetic, and when we are in parasympathetic mode, that's when the body can rest and it can repair. It can digest. That's time we can reproduce. It's when the body's recovering and regenerating. Parasympathetic. This is where we should spend most of our time in reality. Now, unfortunately, we spend much of our time in the sympathetic. Now, what is this? This is fight or flight. This is stress. What's happening is that the body is trying to make us adapt, if you like, to a stressor. Of course, in the old days, we were trying to escape from a lion or a tiger, or we were in some kind of situation where we were in combat, and what we needed all our body to fight or run away. Now, we still live in a stressful life, but it's very, very different. We don't get away from our stresses because it's part of the world that we live in. And unfortunately, we're now living in this sympathetic state where our body is in a state of fight or flight much of the time. And it's releasing stress hormones. What do those stress hormones do? They affect all the organs that you see there. And it's creating this adaptive physiology. The body is always adapting to the environment that we're in, and it's a very stressful environment. Now, what we do as chiropractors, we're working with the nerves to relieve the stress on this nervous system. But let's just think about this stressful environment. What's actually happening, and why is it so dangerous to us? So we have this adaptive physiology, and at any one time, we're either upregulating or downregulating things. So think about it. If we go into stress, what happens to our blood? It goes up. Our heart rate goes up. Muscle tone is increased so we can run away. Cholesterol goes up, and there are clotting factors released. So if we do have some kind of injury, then the blood actually will clot and we won't bleed out. We become very fearful and anxious because, again, this is the adaptive physiology that's there to help us survive. What else is happening? Well, insulation sensitivity is being down-regulating. So what will this do eventually if we're in this state all the time? Yeah, it's going to lead to diabetes and blood sugar.
Oh, okay.
Blood sugar is actually... There's somebody talking, so can I just ask you to mute for me? Thank you so much. So during this adaptive physiology, our blood sugar is released So it goes up, so we have more energy to deal with this stress. But what's happening, because it's not needed in times of stress, our immune system is turned off. It's down-regulated. Obviously, our sex drive is not needed if we're suffering from stress, if we're running away from a lion or tiger, so that's shut off. But also, we have decreased serotonin, and our sleep cycles are interrupted as well. We don't need to sleep if we're dealing with the stressor. Now, very importantly for this particular subject, digestion is turned off. It uses an enormous amount of energy to digest and assimilate food that we ingest. So during times of stress, to help us survive, your digestion is turned off. Well, obviously, this is very, very dangerous if we are living in this stressed state all the time, which unfortunately most of us are. If stress is a short-term thing, then this adaptive physiology I'm talking about is brilliant. It's a perfect response. It's an adaptation to an acute stressor. We deal with it, and then we get back on with life in parasympathetic mode. But if we are dealing with these stresses all day, every day, it becomes very, very, very unhealthy. So let's just think a little bit more about the nervous system. This is probably my favorite illustration as a chiropractor, because what we see here is the brain communicating through the spine and to all the organs there. Many of those organs are digestive organs, of course. Obviously, if there are postural problems, or think about posture for one moment. If we have bad posture, we're slouching and everything, what's it doing to the organs? Of course, it's compressing them. It's creating less space for things to work correctly. But also, if we have bad alignment through bad posture, then our very vertebrae come out of alignment, and then it can start pinching nerves or affecting nerves, irritating them. Now, if we get irritated nerves, what might it do to the organ at the end? On the right, you can see we've got a circuit breaker, and the spine can literally act as a bit of a circuit breaker. If we have nerves being irritated or pinched, then it's going to flick the switch of the circuit breaker. If you've got problems in the mid-back, then that flips the switch of the circuit breaker, and then perhaps if those nerves are going to your lungs, perhaps you're not breathing as well. I think it's fairly simple analogy to work with. I think you sort of get it. Now, what are we dealing with every single day in our clinics are things called subluxations, which are basically joint misalignments. There's only one efficient shape for the spine. There's only one efficient posture. Anything that strays away from that is inefficient, and it's putting stresses and strains on our system. We can get a situation where these joints are or misalignment, which is causing soft tissue damage, nerve irritation, muscle spasm, all these things. But what's it going to do? It's going to cause an increase in stress on our nerves. And then what happens then? We get stress hormones released, and then we are back into that fight or flight mode. And then that is dampening and changing our expression of our digestive system. This really is a very stressful life. And we all have these stresses. You can see in the top left, somebody driving around in their car. Let's hope you don't have bad habits associated with driving and you're crashing all the time. But one thing I bet we've all got some bad habits. I know I do. I'm aware of it. I have to take steps to try and balance them. Whether it's too many hours on the computer, dealing with the stresses and strains of modern life, or maybe it's just having my head forward, always checking my phone. These bad habits cause stressors. These stressors, there's something called bioaccumulation. They add up, they build up in the system. And then before we know it, we are getting symptoms. Now, many of the symptoms that we get going through life, we can trace them to our digestion. All right, our digestion is a way that we can monitor our health. Actually, I have a dog in our house, and one of the ways I monitor the health of my dog and our cat is you can check the quality of their coat, you can look in their eyes, but you can also check their poo. And we all know that if we're not feeling so well, the consistency of the poo deteriorates. And so I want us to start thinking in terms of this. How well are we passing things? So start thinking of the quality of our stool and things like that. Okay. One thing that we're all going to suffer with is chronic constipation. Like, oh, we know the feeling. We don't want to go there. But let's think about what's happening. Instead of just popping pills, because they do work, but there will be side effects. You can't be taking these pills long term. So what's happening? Well, obviously it's a motility problem. So what's causing a loss of motility? Well, it could be various things. Obviously, we could think about the food that we're eating. We could think about, is there enough fiber in our diet? But we can also think about what is stopping the flow of our waste through our system. Well, it works through something called the migrating motor complex. So we actually have motor nerves, muscles in our digestive tract, which cause a wave that actually pushes it through our system. This wave of energy that passes through, moving things along healthily, is called peristalsis. And if we are stressed, if our nervous system is compromised, then remember what's happening. Our digestive system is being prevented from working properly. So we lose this wave of peristalsis, and then we start getting back up. And then we've got this constipation. Okay, this is where we work as chiropractors. Obviously, what do? We work with the spine. We also are going to be talking about sleep. We're going to be talking about healthy habits. What are we taking? Are we getting enough water into the system? Because that's obviously lubricates things to help it pass through. But as chiropractors, we are certainly going to be working with the spine. If we know that somebody has got some chronic constipation or even diarrhea, it all goes back to the same areas of the spine. So let's just think about it for a moment. These are the areas that we are specifically going to be looking at. C1 to C3, where's that? That's right at the top of the spine. So what's going on here? You remember I spoke about the autonomic nervous system, which we can see here, and there's two parts. There's the sympathetic, which is the stress system. Well, the sympathetic part is the yellow nerves that you see there, going from the spine to the organs. But you'll also see some blue nerves coming from the top and coming from the bottom. Well, this is the parasympathetics, okay? We want to make sure the parasympathetic nervous system, and the one that comes down from the top, it's called the vagus nerve. It's called the wandering nerve because it leaves the spinal cord, the brainstem at the top, and then it wanders through the body, connecting to all the viscera, all the organs. We need to make sure that's working properly. So we are always going to be clearing out any interference on these important nerves at the top. Now we're also going to go to the bottom. Yeah, you see the blue nerve at the bottom? Of course, so this is L5 to S3. This also is the parasympathetics. We are certainly going to be dealing with this area to make sure there's no irritation or anything interfering with these important nerves. And then, of course, if we look in the middle of the spine, all those yellow nerves, if they are being irritated, then you could actually get the sympathetic nervous system firing into those organs, disturbing how they're working. So, of course, we're going to be going into those areas. So these are the areas that we will always be looking at as chiropractors. We clear out problems in these areas, and it's amazing what digestive problems start to clear up. So we're gonna continue going through some of these conditions. So what about irritable bowel syndrome or Crohn's disease or celiac disease? Now, what's going on here? Well, these are all inflammatory conditions. So inflammation. We know that when we have a condition in the body, when the medical profession name it, they put itis on the end. Itis is inflammation, okay? If you've got inflammation of a joint, it's arthritis. If you've got inflammation of anything, there will be itis on the end, okay? So what would be causing irritation? What's going to be irritating your system to an extent that you get this inflammation in the bowels? Well, it's stressors. I come back to the great stressors again. Remember the 3 stressors. Of course, there can be thoughts, but of course there's toxins. And unfortunately, the toxins, these chemicals, these dangerous chemicals that keep coming into our body from everywhere, are coming from our food. They're coming from stresses that are coming from just toxic exposure in our environment. It's also coming from gluten. Let's talk for a moment about gluten. Gluten is something that is not naturally in our diet. It's something that we developed to try and feed a growing population. But unfortunately, many of us are actually allergic to gluten, and it causes a problem. We'll talk more about that in a moment. Of course, infections in the gut, that's going to be causing stresses to our system. What about genetically modified organisms, GMOs, genetically modified crops that we put into our body? All these things that are going into the body, they are not natural. They are stresses to the system. And then of course, stress itself, as we've mentioned. Remember, health starts in the gut. It doesn't need stressing all the time. What about this toxic exposure which is everywhere? Unfortunately, it's in the food that we eat. I mean, really, the food that you put into our body, it's either meant to sustain life or something else. Unfortunately, much of the food that we put into our bodies nowadays is designed more for shelf life in the supermarkets. Think about it. We have small print on medications, but there's also small print on the food packets. Have a look. If there are words that you don't understand or can't even pronounce, then please, that food probably shouldn't be put into our bodies, and certainly not into the bodies of our children. Medications. Again, medications we put into the body, it's changing the environment in our gut. It's causing problems. Household products I've mentioned. The air that we breathe, it's got toxins in it. It's all going into our body. GMOs and stress. So when I look into my refrigerator, usually I control what goes into the bodies of my children quite closely. But when I see what's in the supermarket trolleys of the people that I encounter in supermarkets, I find it frightening. And you see all these things, these colored, where does all this coloring come from? This is not good stuff. This is all chemicals. We've got to remember that what we put into our bodies either sustains life and vitality, or it drives us very much towards disease. So let's go on to some of the stresses on the inside of our gut that's causing all these inflammatory conditions. I've said the biggest word on that page there is grains, because this is a big one. Also dairy and also sugar. But let's just think it. So grain, we know that grain nowadays it's acidic. It drives us away from having a nice alkaline environment. It has very low nutrient density. It's full of omega-6s, which are inflammatory, very high in the glycemic index, which means it breaks down into sugars very quickly. These are all toxic to our bodies. They have irritant properties, and they lead to something called leaky gut syndrome. Now, I'm going to talk about this because this really, really, really is extremely, extremely important. We're going to do a little bit of a deep dive into how the gut works here and how it looks from the inside. So we've all got a gut. And what is it? It's a tube that goes from our mouth to our anus, all the way through. It's the inside of our gut is actually counted as the outside of our body. So where the outside of the body meets the inside of our body is in the gut wall. It is designed to do some very, very important things. It's designed to break down all the foods that we ingest and break them down into the smallest bits. So the micronutrients, the vitamins, the minerals, the amino acids, the glucose, the fatty acids. This is what food breaks down to. And then it allows the good stuff to pass to the inside into our blood. So let's just see what's happening here. So I like this picture very, very much. What you see there, it's actually an electron microscope, and it's a picture of the gut wall. It could be your gut wall, could be mine. But what you see there are microvilli. Villi it's the inside of the gut, blown up 4,000 times. But this is what you see. These microvilli they're there to increase the surface area of the gut, so that there's more area that can actually absorb the nutrients that we need to. Now, what we've got, all these little microvilli and all these cells, they've got to do something very, very important. They've got to control what passes from the gut into the blood. So they've got junctions. Now we're going to move to the next slide. So here we see on the left-hand side, you can see some normal gut lining. So what you see, the gut lining is only one cell thick. And all these cells have got something between them called tight junctions. They're snapped together very tightly by a protein called zonulin. And then on the surface of these cells, you can see the villi, which we saw in the previous picture. Now, what we want is these tight junctions are the thing that determines what passes through from the inside of the gut into the blood. On the left, these tight junctions are working properly, and they're just allowing the good stuff in, the stuff we want, the vitamins, the nutrients, all the good stuff. Okay, it's coming through into the blood. Now, on the right-hand side, you can see where there's been some, spot the typo there, there's been some inflammation. Now, this has damaged the tight junctions. There's these zonulin clips that clip the cells together. So we've now got inflammation in the gut lining, and you can see how these junctions are opening up. Now, unfortunately, we can get bad stuff from the gut through into the blood. So what might this be? Well, yes, you are going to get the good stuff passing through, but you also might get undigested proteins. So proteins that haven't been broken all the way down into their amino acids. So little bits of protein, real bits of protein can get through. Now, what might this do? Well, lumps of protein, undigested protein, should not be in our blood. So what does the body have to do? It has to launch an immune attack on this protein. So we now have a situation where our body is attacking protein, but we've got our body is made of proteins. So any of these little bits of protein that are being attacked by our nervous system, if they are like any of the proteins in our body, then the body is actually learning how to attack itself. Our immune system will attack the protein and any proteins in our body that like it. It's called protein mimicry. So if these little bits of protein are being attacked, if they are similar to the lining of our joints, we're going to develop rheumatoid arthritis. If they mimic parts of the protein in our digestive system, we're going to get some kind of colitis or celiac disease. If it's going to attack proteins that mimic the myelin sheaths in our nervous system, we're going to get multiple sclerosis. So I'm talking about autoimmune disorders, which we're going to talk about in the future. Now, what else could be happening? Well, of course, there's all kinds of toxins in our gut. We have an immune system that should be taking them out. We have a mucous membrane in the gut with immunoglobulins that should be searching these and taking them out through the stool. But if the mucus is in our gut is being compromised, then we're getting these toxins through into the blood. Of course, the body cannot allow these things to go. It's got to take them out. So again, there's going to be this immune response to toxins getting through. And of course, where does the blood go? The blood goes everywhere. So we've now got this inflammation going all over the body, and we get this inflamed body. And this is a huge problem nowadays. And it's autoimmune, and it's leading to systemic inflammation. I hope all that makes sense. If any questions on that, do ask at the end, because this is really important. So we have this situation where almost everybody nowadays has leaky gut to some extent. So many people, I mean, if you think of all the autoimmune conditions that people get nowadays, they are literally everywhere. And there's over 150 of them. They're all named and by the medical community. But if we add them all up, it literally is the #1 problem on the planet at the moment. It's literally taken over from heart disease as the #1. Autoimmune conditions, whether it be rheumatoid arthritis, MS, but all the things like diabetes, type 1 diabetes, psoriasis, Hashimoto's, Graves' disease. This is where the thyroid is being attacked by the immune system, celiac, Addison's, dementia. I could go on and on and on. And when these are all added together, these are account for a huge proportion of the conditions that we suffer nowadays. Okay? Let's just remind ourselves what's happening. So leaky gut, the proper name for it is actually intestinal hyperpermeability. So we've got too much stuff is permeating through the membrane, through these junctions which are opening, allowing the bad stuff. So chemicals and toxins are accessing the bloodstream, and this is leading to abnormalities in the immune system, food allergies. Most of our food allergies, this is where it's coming from. And much of the autoimmune pain is coming from this direction. Okay. Now, on the bottom of that, we see dementia. Dementia is a huge problem. It's a growing problem. And I heard a statistic which scared me to death, but when I think about it deeply, I know it's right. The chances of us eventually suffering from dementia nowadays is 100%. Okay, we're now living a long time, and everybody is getting some kind of slowing down of our brain. It doesn't have to happen. Let's think why it's happening, and let's do something about it right now, so we can slow it down and minimize the effects. If we've got leaky gut, and most people end up with some kind of leaky gut, we also have leaky brain. So we end up with degeneration in the brain. So what's happening again? It's the inflammation that's coming from the gut into our blood. It's crossing the blood-brain barrier. It's going into our brain, and that's leading to problems. Dementia, we know that Parkinson's, Alzheimer's. Okay, these are inflammatory conditions of the brain. These are being tracked right back to the gut. So this really, really, really is important. So let's talk about a few things that we can do to prevent it. Of course, obviously there's do's and don'ts. Do's, well, we've got to get the food right. I'm not going to be talking too much about nutrition today, but really we've got to start eating more food by God, if you like. We've got to stop eating the refined carbohydrates and cereal grains that tend to be GMO. They're not suited to our digestive system. We've got to stop taking food with all these chemical sweeteners and bad vegetable oils, which are inflammatory. So many people are actually find legumes, which are beans and things like that, find that them quite irritating. So some people are okay, some people not. So we have to keep an eye on it. Dairy produce, soda, toxins, we've got to keep away from them. We've got to concentrate on just having natural food. You know, fruits and vegetables, good quality meat, range-fed eggs, natural fats, good fats, nuts and seeds, good quality water, not fluoridated water, okay? We want to have an alkaline diet, okay? It's the way we've got to go. So going back to being a chiropractor, when people have got these irritable bowel syndromes, these inflammatory conditions, what are we going to be doing as chiropractors? Of course, we're going to be looking to the most important nerves. Of course, we're going to be adjusting the upper cervical, the C1 area. We've got to be quiet. We've got to be moving us back down into the parasympathetic mode. We've got to be quietening down the sympathetics. So we are adjusting the mid-backs. Look where those nerves go. Those yellow nerves, they go straight to the heart. They go to the lungs, but of course they're going to the stomach, and they're going to the digestive tract. Okay, it's very, very, very important to keep your spine clear of inflammation, of irritation and inflammation. So what about acid reflux? This is something that we see more and more everywhere. It's something that people tend to be popping pills for. Again, what is happening here? It's a body signal. Many people will take antacids to calm down the acid, to stop the production of acid. Well, I have to tell you, usually it's not too much acid, it's too little acid. And what we're doing by taking the drugs is absolutely the wrong thing. What's happening is that we haven't got too much digestion, we've got too little digestion. There's not enough stomach acid. So we should be encouraging it. And how do we do that? By improving function. Okay? So what do we do as chiropractors? Well, we look to where the function comes from. So we are restoring the function of the nerves, the enteric nervous system, the balance in the nerves, so that the valves open correctly, so that the release of the acid is correct. This is all choreographed by the enteric nervous system, and that all comes back to the autonomic nervous system. Okay, it all comes back to the nerves. So I'm talking a lot about the nervous system, and we have to relate it very much back to the world that we live in. All the time, we are putting our bodies, and that our children go through the same thing. I'm sure many of you are sitting in a position right now where you're putting micro trauma on your bodies. So this is what we see: micro trauma, misalignment of the spine. People are developing tech neck everywhere you look. Everywhere you look, the head is forward. People are getting this bad posture. It's compressing the digestive system. It's affecting the flow of the what we're trying to digest through the system. It's affecting the nerves. It's stimulating the sympathetic nervous system, and that's affecting everything. We've got to always look to get back into balance. We're always getting back into homeostasis. This is what we do, what I do is all about. And as chiropractors, we are always going back to what we call the three-legged stool. Three-legged stool is balance. So let's go back to digestion. How are we going to get our body back into balance so that that our digestion is going to work correctly, and we're not going to get all these terrible conditions? First of all, we've got to break all the bad habits. This is the chiropractic lifestyle I always talk about, which is talking about the pillars of health, all of them. Whether it's exercise, it's nutrition, it's minimizing stress, it's good habits of sleep, it's good thought, it's positivity, it's all these things. We've got to think about what we do all day, every day, and we've got to be getting ourselves always back into a state of parasympathetic, okay? So the body can heal, the immune system can work correctly, and we can digest our food. We've got to add specific exercise. Our body's got to move properly. Remember, it's all about function. Sitting all day, every day. I'm sure most of you are sitting right now, but you know, what are you doing? All that weight is on those bottom vertebrae. It's on those discs at the bottom. It's irritating those very important nerves at the bottom of your spine. It's compressing your organs. It's literally preventing digestion and the movement through your colon. Okay, and then of course we come back to chiropractic. What are we doing in chiropractic? We are absolutely normalizing function. We are normalizing function. So function of the body, so that you can exercise. Plenty of movement means better function, means your digestion is working better. The chiropractic, what are we doing? We're looking for areas of subluxation, areas where the spine's not working properly, areas where there is stimulation of the wrong side of the autonomic nervous system, the stress side. So our adjustments, not only are we freeing up the nerves, but we are shifting you back into parasympathetic, where it's the fastest way of shutting or quieting down the sympathetic nerves and stimulating the parasympathetic nerves. Okay, chiropractic is not just for pain, it's much, much more for that. And that's why in our clinics, as we start to work with people, improving postures, improving function, when we talk to people in our reevaluations after 12 visits to 24, people are sleeping better, people have less pain for sure, but they are very aware that they're moving better and they're having better movement. Their body is working better. Okay, very, very important. I've gone through a lot of stuff there. If you have any questions, please address them to me. It's all about function. It's all about playing the long game. Playing the short game is being tunnel vision. It's thinking only about pain. I want the pain to go, taking pills. This is not thinking intelligently about how the body works. Chiropractic, what we do, what we encourage you, the lifestyle we encourage you to embrace is thinking a little bit more deeply. It's thinking intelligently about the function of the body. Now, what I'd like to do is wrap up now and answer any questions that anyone may have. And I very much want to invite anybody that's watching, or this is being recorded, it'll go out to many, many more people. If anybody feels that they need to come in because of perhaps digestive disorders, or maybe it's just pain, anything to do with it, obviously posture and the spine, it relates to our nervous system and it relates to digestion. So to help people find their way into our clinics, there's a QR code there. Go ahead and take a picture of it. This allows anybody to come in to any of our 5 clinics. Remember, we have 5 clinics around Singapore, 2 in the CBD. We've got Tampines, we've got Clementi, we've got Topayo. Normally people come into our clinics for over $170. This allows people to come in for only $45. Okay, so keep that. I encourage you to follow us on social media. We are putting good stuff out on a daily basis, and it's all about helping people maintain homeostasis, live without pain, live at a much higher function. So let's just have a look to see if there's any questions there. From Stephanie, TCM acupuncture using massage chair interfere with chiropractic treatment. So Stephanie is asking, will TCM or acupuncture or using massage chair interfere with chiro treatments? Actually, no, it won't. I'm not really worried about that. What you are doing very much is you're dealing with some acute pain at that moment. It's making your body feel a bit better. Everybody likes a massage. Of course, it's helping you, and that that's a short-term fix. In chiropractic, we've got a bigger picture going on. We're looking more down the line. We're preventing very much what's coming down the tracks. So no, you are okay going for TCM. Acupuncture, yeah, again, it's great for making you feel better short term, but it tends not to be a long-term fix. So I'm not too worried there. I'm not seeing any more questions at the moment. So with that in mind, please feel free. If you think of any questions, then feel free to email me or contact me via social media. We certainly don't hide. We're there to help. We're certainly there to provide a service. So I shall go ahead and wrap up now. So I'd like to thank you enormously for listening. And remember, we are always here for you. It's all about living a healthy life. And that's what we at Total Health Chiropractic are all about. So thank you very much. Enjoy the rest of your day. And I shall speak to you soon. Take care. Bye-bye.